I actually came to Nigeria about 5 years ago with the idea of starting an air ambulance charity. And that's because a few years before I came, my sister came to Nigeria on holiday, and she was 12 years old, and she became very sick while she was here. And we decided as a family that we're going to fly her back to England for treatment. But by the time we could get everything organized, get the air ambulance organized from South Africa, my sister had died. Now, we come from a very, very close-knit family, and I was completely devastated by the news. I was in medical school at the time, and I locked myself in my room for 3 days and didn't come out. By the time I came out, the provost and about 5 staff of my medical school were at my door because my housemates had to report at some point that something had gone really terribly wrong with me. And it was at that time, after that, that I started thinking about the problem, one of the greatest problems in healthcare, and something that we've spoken about earlier, the problem of patient logistics, getting the right patient to the right medical facility at the right time frame. And I think it's one of the greatest healthcare problems, global healthcare problems in the world, which is just logistics. So I came here with the idea of starting an air ambulance charity. And this charity would be responsible for working in Nigeria to move people from areas where they have overwhelmed the level of care to a more suitable level of care. I didn't know anything about running a charity, but as I landed in Nigeria and started learning about Nigeria, I realized that probably the charity wasn't the right model for me to do. I know that there's a lot that NGOs and charities do contribute to healthcare, and they make a very, very valid and very good contribution to healthcare in Africa. And probably in our fight against infectious diseases and other diseases, we wouldn't be where we are if not for the work of charities. But for me personally, it reminded me a bit of, I used to live in Japan, and it reminded me a bit of when I went on a date with a Japanese guy, and the date was going really well until he told me that he was like 40 and still lived with his mom. And I'm like, so why did you live with your mother? He was like, oh, but my mother does my laundry, she helps me with everything. If I need financial help, then she still helps me with that as well. And I'm like, so every time you need something, washing clothes, money, car, you go back to your mother? And he said yes. And the charity business model kind of, it made me think about that. So every time I need something, I need to go back to America, I need to go back to the UK and ask for more money. And then it's those donors that now direct everything that I'm going to do. So for me, I wanted something that was more sustainable than that, and something that I could hold direction for, and something that was gave me a little sense of independence. So that's when I came up with starting an air ambulance business. And what I wanted to do there was run a profitable business with our aircrafts that could really save lives in Nigeria, make a difference across West Africa. So we did that for about 2.5 years. And it was very profitable, of course. We have a huge oil and gas industry in Nigeria, and they supported the business. But we were still only meeting about the needs of about 1% of the population, the people that could afford an air ambulance jet or an air ambulance helicopter. And I started to feel that even though at the time, we're making good margins and good profit, it didn't have the impact that I initially wanted. So would I go back to the charity, or would I try something different? And that's when we started thinking around what technology was available to make the aircrafts cheap enough for the average Nigerian to afford. So we started looking around and thinking, how would we need to get a smaller aircraft? But even the smallest aircrafts that we could find were still too expensive. At the time, an international evacuation was around $60,000, and the local evacuation was around $20,000. So it was out of reach for most Nigerians. So I started, as I was flying from Lagos to Abuja a lot because we're doing some work with the military, I started thinking about all the empty seats I could see. Eru, half of the seats would be empty. Dana, half of the seats would be empty. Arik, half of the seats would be empty. And I'm like, you know what? I could put patients in this plane. So I spoke to the MD of Arik, and I said, if I could find something, somehow structure something where the empty seats in your plane could actually be used to transport patients, would you be willing to do business with me? And he said, I don't think that's possible, but go ahead and make your findings. So we got a team together and looked into companies that could help us design something that could take advantage of the empty space in normal commercial flights flying around Nigeria and provide a service to people at an acceptable cost. And that's how we came up with the ETU. So that's an ARIC plane there. It takes 4 to 6 seats in the back of any commercial plane. So we're just really riding on what is already existing. The airlines are winning because they would have had empty seats otherwise, which we've filled. The patient is winning because he's only paying for a small number of seats. And we're also making a margin off of the service that we're able to provide. So we're able to reduce the price of Medivac abroad from $60,000 to less than $20,000. And within Nigeria, what was $20,000 is now less than $1,000. So we've been able to, through thinking creatively and using latent capacity, really, because that capacity was being wasted before, we're now able to use it through the ARIC network all over West Africa and in Nigeria. And the most interesting thing about this is it actually creates value for Nigeria as well, because we've realized that a lot of countries within West Africa actually have always wanted to come for healthcare in Nigeria. So this was the thing that we didn't expect, and we're calling it the reverse medical tourism phenomenon, where patients from Sierra Leone, patients from Gambia actually come into Nigeria for medical treatment and then fly back to their countries, which they weren't able to do when we're using private planes. So after the ETU, I started thinking, okay, I've done this now. How can I add value to more types of businesses? And together with 3 of my friends, we started a tech investment company. So we have about 5 portfolio companies now that we've actually invested our funds in, and we're helping them to grow. Obviously, we're all business owners or financial experts, so we've been able to help them accelerate, either get into accelerators or help them grow their markets. We have investments in fintech, software, media, and we're actually looking for healthcare companies that we can invest in and also help them to grow, because that's like the whole impact life cycle for me. To be able to build a business that is profitable, be able to take the business to the next level, and then use the money from that business to be able to help other businesses to grow as well. And in that way, perhaps I feel that we'll be making our little contribution towards taking us from that dependence that I talked about earlier, where we are still living with our mother, always having to go and ask mother for different things that we need, to actually being independent, and maybe even getting to the stage where we start saying, okay, Mom, let me buy you a house because we have too much here. So we want to get to the point where we're actually service providers. We've been through the stage, Africa has been through the stage where we're always having to look for aid. We're always having to go to the West to look for aid. But I think that by investing in homegrown businesses, we can get to the point where we're actually going back to Europe, going back to America and saying, actually, we have really, really good services here. We've developed our technology to a point that we feel that we can actually be service providers to you now. Maybe we can improve your software. Maybe we can improve your healthcare. Maybe we can help you with your banking software. So the hard lessons that I learned along this journey, like how to be sustainable, and it was a big issue for me when I first came, obviously trying to source for the funds to be sustainable. I think a lot of American companies have such a long runway to become sustainable. I was reading that General Electric, if you look at their debt, it's almost like $100 billion. And our budget in Nigeria is $20 billion. So I think there's a lot more runway. There's a lot more, the financial systems are a lot more deep in terms of funding. So it's easier to become sustainable. So we have to be a lot more frugal when we're building our businesses and a lot more innovative, because our banking systems, our financial systems are not really deep enough to support those kind of businesses. I think the second thing is also, it was moving from a technician into an entrepreneur and a manager. And that was another hard lesson I learned. Just because I was very good at medicine doesn't necessarily mean, it didn't translate immediately to me being very good at business. And I think there's a lot of technicians in the room that might be running government organizations or NGOs or private businesses going through the same thing. How do I move from being a technician to being an entrepreneur? Or being a manager. So the technician lives in the past, really. It's all academic, isn't it? It's all what we learned 5 years ago. Whereas the manager lives more in the present and is thinking, okay, what's going on now? What challenges do I have now? But the entrepreneur lives in the future. So the entrepreneur is always thinking, what can be? What are the possibilities? So balancing those three sides of myself, I think, was another hard thing that I had to learn. And the third thing, and probably the most important thing, is allowing myself to make mistakes. As a student, and I'm sure like we're all healthcare professionals and academics, in school we're told never to make mistakes. We're told that mistakes are a bad thing. Anytime you get a question wrong, there's a reprimand. Whereas in organizational development, whether it's an NGO, whether it's a public service organization, whether it's a business, there needs to be some leeway for us to make mistakes, because mistakes are the way that human beings learn. And I think the important thing is just to be standing on top of the mistakes, not lying under them. Thank you.